An assisted living facility in North Miami Beach is being evacuated. The images there we're showing you, we're told the facility has no power, and they're evacuating around 80 patients right now. So again, that's happening in Miami Beach. I want to bring in family physician in front of the show, Jen Caudle. Dr. Jen Caudle, a delight to talk to you. This always makes any of us crazy, right? The people that are most vulnerable, that need our help, are the ones that we're talking about here. You see some evacuations happening there in Miami Beach, those 6 deaths in Hollywood, Florida. Help us understand why the elderly population, especially in a home like that, would be so vulnerable. I understand if the power goes out and maybe they have equipment that is set up to care for them, maybe oxygen pumps or what have you. But why would the AC going out ultimately harm them in such a way?
Well, Michaela, it's great to be here, and this is such a tragic, sad story that we hope that we don't see much more of. You're absolutely right. Heat can make a big difference, and when it comes to the elderly, it can be even more than those who are not elderly. For example, there are a few reasons why elderly are at particularly high risk for heat-related illness. Many elderly take more medications and have more chronic medical conditions than other people. Many times the elderly have other issues, sensory problems, don't hear as well, see as well, and may have mental issues, mental status issues, dementia, Alzheimer's, that might make it more difficult to perceive being too warm and also difficult to communicate this. But there are other risk factors as well. Those who have heart disease, those who are obese are at higher risk. But when it comes to heat-related illness, those who are older, those who are younger, and those who have chronic medical conditions tend to be at the highest risk.
So essentially, it's the body's ability to regulate heat. And if, like you said, if they have communication issues, I don't know if this was a facility that dealt with memory care patients, things like that, or people that are not even verbal, that would be a real challenge. And especially given the fact that the staff there is already dealing with an emergency, right? The power's out, et cetera.
Absolutely, and I think that's a really important issue is what happens as we get older is our body is not able to deal with heat as well as when we're younger. And also keep something else in mind, when we're talking about Florida, we're often talking about humidity. Our body's natural way of cooling itself is to sweat. But when we get into areas of high humidity, which is very likely what's going on, our body doesn't sweat as well. So you've got older individuals who don't deal with heat as well anyway. They've got multiple risk factors, medications, chronic conditions, etc. But then you potentially have a situation with high humidity, and it can be very, very dangerous, not only and deadly potentially.
Why was 911 not called? I keep saying this over and over. Why wasn't anyone alerted? A neighboring facility could have helped. So many questions that are begging to be answered. Dr. Jen Caudle, thank you so much for talking to us about some of the health issues some of these seniors may be dealing with.